This is a 2-minute warning. Reporters on the line, please press 1 to ask a question.
Well, good afternoon, everybody, and thank you for joining North Carolina's update on the COVID pandemic. As of today, we have had 1,007,273 cases, 464 new cases reported since yesterday, 548 people in the hospital, and sadly, 13,246 people who have died. Just this morning, I was in Salisbury and learned about the death of Sergeant Shane Carricker, a 20-year veteran with the Salisbury Police Department. For anyone who has lost a loved one to COVID-19, including Sergeant Carricker's family, we hold you in our prayers as you mourn. As we continue to emerge from this pandemic, one day at a time, we know that vaccines are the key to beating this virus. The proof is overwhelming and irrefutable. Vaccines are safe and effective. They protect you and the people around you. If you don't believe Dr. Cohen and me, ask your doctor. Since the beginning of our vaccine effort, our goal has been to get shots in arms as fast and fair as possible. We've made tremendous progress, and now the vaccines are widely available. But in North Carolina, we still have around 2.5 million adults who are not vaccinated. Getting this life-saving vaccine to those people is critical for the health of our people and the health of our economy. So we're pulling out all the stops. Last month, our state health officials launched the Summer Cash Card program in 4 counties. With this pilot program, if you get a first dose or even if you drive someone to get a shot, you get a $25 cash card. The response has been promising in these 4 counties. Early analysis shows an increase in vaccination compared to the overall county trend. More counties will be added in the coming weeks. And we are pleased that businesses across our state are offering cash, food, drinks, vacation time, and other incentives to get their employees and their customers vaccinated. But we know that more must be done to encourage people to take their shot. After studying how similar efforts have boosted vaccine rates in other states, today we are announcing that North Carolina will launch cash drawings for our residents who have gotten a vaccine. It's your shot at $1 million, summer cash drawing. Here's how it'll work. Over the next 3 months of summer, 4 people will win $1 million each, simply for being North Carolinians who have gotten at least 1 vaccine in our state. North Carolinians 18 and over who get vaccinated or have already been vaccinated will be automatically entered. North Carolinians from 12 to 17 who've gotten at least 1 shot are automatically entered into 4 drawings to pay $125,000 for college education at a school of their choice. Regardless of who wins, there is no way to lose. A chance at $1 million or a college scholarship is pretty good motivation. But even if your name isn't drawn, the worst you'll do is getting strong protection from a deadly virus. So start today. Get vaccinated or drive someone who needs encouragement. The first drawing will be on June 23rd, and they will occur every other week until the last one on August the 4th. The drawings will take place every other Wednesday. And for extra incentive, anyone getting their first shot from today going forward will be entered twice for each drawing. Getting that first shot now will double your chances each time a name is picked. Of course, the best reason to get vaccinated is to protect yourself, your friends, and your family. And now, most people aren't wearing masks in most places, so unvaccinated people can be a real danger to each other. We are making progress, but still need more people vaccinated to keep this virus from rising up again. That's why North Carolina is using federal coronavirus relief funds for this program. After seeing the benefit in other states, we believe this program will help get more North Carolinians vaccinated, making our state a safer place for everybody. I'd now like to ask Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, to say a word or two to us. Dr. Cohen.
Thank you, Governor. These summer cash drawings add another reward to the many that come with getting a COVID-19 vaccine. Getting a vaccine is the best way to protect yourself and your community from COVID-19. Rigorous clinical trials using thousands of people ages 12 and up have proven that the vaccines are safe and effective. More than 140 million Americans have now been safely vaccinated and protected from serious illness and virus-related hospitalizations and death. Here in North Carolina, we need to do better with vaccinations. Fewer people here in North Carolina are protected from COVID-19 than in many other states. While our COVID trends are good, we are still seeing people hospitalized and dying from this virus. And many who have had COVID-19 struggle with long-term effects, like losing their sense of smell or having difficulty breathing when doing simple activities. This is preventable if you get a vaccine to protect yourself and your community. We're going to keep using a range of strategies to support people getting vaccinated. We've been consulting with researchers who have expertise in incentives and supporting vaccinations, as well as looking at what is working around the country. With today's announcement, North Carolina is joining other states that have million-dollar drawings to promote vaccinations. Ohio was the first state to launch such a program, and they reported a 28% increase in vaccinations among those 16 and older in the first 2 weeks following their announcement. So now, as part of North Carolina's Bringing Summer Back campaign, North Carolinians can also win. 4 residents ages 18 and older will win $1 million cash prizes, and 4 residents between the ages of 12 and 17 will win $125,000 towards a post-secondary education. Residents who have already received at least 1 dose by a North Carolina vaccine provider are automatically entered into the drawing. Anyone vaccinated starting today will be entered twice for each drawing. The sooner you get vaccinated, the more chances you have to win. The drawings will be supported by the North Carolina State Lottery Director, and the scholarship funds will be managed by the North Carolina State Education Assistance Authority. There are many reasons why more than 45% of adults in North Carolina have not taken their shot. Some people may need help covering the cost of taking time away from work or for transportation costs. This is where that $25 summer cash card, as mentioned by the governor, is one of the ways we can address those challenges. Others may need an extra reason to stop waiting to get vaccinated. And this chance to win $1 million or the money towards a post-secondary education might be that reason. Other people want to hear from those around them who have gotten vaccinated. So if you've been vaccinated, please talk to your friends and family about your experience. Share why you got vaccinated. These conversations are really helping people decide whether or not to get the vaccine. Everyone who gets a COVID-19 vaccine is a winner. They protect themselves, their loved ones, and others from severe illness, hospitalization, and death. And you can learn more about your shot at $1 million at summervaxcash.com. Thank you, Governor.
Thanks, Dr. Cohen. Already we're seeing these vaccines are helping us do the things we love to do safely. Gathering with friends and family, eating indoors at a restaurant, going to a game, hugging a grandchild. All of that is a testament to just how safe and effective these vaccines are. And the more North Carolinians who get vaccinated, the sooner we can put this pandemic fully behind us. Also with me today is our Secretary of Public Safety, Eric Hooks, North Carolina Emergency Management Chief of Staff, Will Ray, and Senior Policy Intergovernmental Affairs Advisor for North Carolina Department of Health and Human Services, Hattie Gawande. And Hattie, thank you and your team for working so hard on helping us put this together. Lee Williamson and David Payne are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now take some questions from reporters who are in the room. If you guys can go to the microphones there, I'll call on you. Whoever gets there first, maybe. Okay, Dawn.
Hi, Dawn Vaughn with the News and Observer. With the current executive order expiring tomorrow, are you going to let that expire? Is there another one being issued?
We will be issuing another executive order. We'll be announcing tomorrow what is in that order, but there will be another one issued tomorrow, yes.
Do you anticipate that the masks in certain indoor settings will be continued? And then, I know I asked about this last week, but the tied to the state of emergency with Virginia's going to let theirs go at the end of June and South Carolina lifting theirs. What's the status for North Carolina and what needs to happen to be like the other states?
I'll be glad to talk to you about that tomorrow. The state of emergency is allowing us to draw down federal funds. It's allowing us to waive state and local regulations to be able to get these vaccines to people faster. So it's an important part of getting this pandemic behind us. But I can talk about the specifics of that order tomorrow and would rather talk about this promotion today.
Just real quick on the federal money, Senate Leader Berger today said that he wasn't sure about what federal money would still be outstanding. What does North Carolina still need to be able to draw that money?
So, I'll be glad to get in this tomorrow, but emergency management, we are paying National Guard soldiers to help us administer vaccines and to do other jobs. There are a lot of other streams of federal money that are important in an emergency situation. Yes.
Adam Owens, WRAL News. Governor, you and Dr. Cohen have made the case for a long time now that getting the shot is the right thing to do for you, for your family, for your community. So what are your thoughts on the place we are now where in order to motivate people we're having to use money?
Well, a lot of people are not opposed to getting a shot, but simply have a busy life, don't realize its importance to themselves and their families. And we are seeing in other states the things that have motivated people to say, okay, I was going to do that anyway. Hey, maybe I can win $1 million, or maybe I'll get this $25 cash card. So whatever motivates people, we want to do what works, because it's not only important for that person and the family, but it's important for our entire state. I mean, we're seeing our numbers continuing to go down. Hospitalizations, people in the ICU, deaths, number of cases, percent positive, all going down, and it's because of the vaccine. But every day we still have people going into the hospital. Every day we have people going into the ICU. Most every day, people are still dying from COVID, so it's still here. And when we know the vaccines are the key to getting this pandemic fully behind us, we need to pull out all the stops and do everything that we can. As to why people are motivated by certain things, you'll have to ask the behavior analysts, which we've asked a lot of them, and researchers, and they tell us that this is one of the ways to give people that little nudge to go. I will say that there are a number of people who are basing their opinion on not getting a shot that's based on misinformation, things that are wrong, and there's a lot of it out there. And that's why I say to everyone out there, if you don't believe me, if you don't believe Dr. Cohen, ask your own doctor about this. Talk with your own doctor about your concerns.
The other question I had, Governor, is do you see a surge of vaccines that you'll be ordering? We've seen in other states that this does cause a spike, so how are you operating around vaccine numbers in the state to accommodate for this promotion?
The good thing is that we have plenty of vaccines. They are easy and they are everywhere. So we are ready. We want people to come and get a vaccine. I'll let Dr. Cohen address specifically about the ordering process. Dr. Cohen.
Thanks, Adam. So the governor is exactly right. We have a great supply of vaccine, not only here in North Carolina, but around the country. So what we're able to do, we actually have a lot of supply of vaccine already here in our state. So I'm not concerned about any increase of numbers. And in fact, we welcome that. We really want folks to come in and get their vaccine as soon as possible. We want them to get protected and get entered into this drawing as soon as possible. But we also have the ability to order vaccine at any point. The flexibility in ordering has really opened up because the supply is so much better. So there really isn't a concern about supply. And if anything, I think our vaccine providers have done a tremendous job of working together. So if there is any shortage in any given day, there's great partnerships and we solve those problems immediately. So really no supply issues or ordering issues going forward, which is great news.
Brian?
Hey, Governor. Hey, Dr. Cohen. It's great to see you guys in person here for the first time. Thanks for having us in.
Now, we've been here a lot, and you could have
though.
come. I know, you could have come, but go ahead.
But I had a question just for each of you. Just first, Governor, for the lottery. If I win, can I stay anonymous? And am I subject to state and federal taxes if I win?
It is a cash drawing. In order to get the money, you have to agree to allow your name to become public. So you cannot take the money and not let anybody know about it. And there are federal and state tax consequences would be subject to income tax. And Hattie, you jump up here behind me if I say anything wrong on that kind of thing.
And then I had a question for Dr. Cohen, just sort of about the effectiveness of the cash card program. We saw a lot of drivers and vaccine recipients in those 4 counties. I'm curious, based on what you guys see as the success of that, if you plan to expand that or if this is going to completely replace that. And just what's your medical advice to people who live in a household where they can't convince someone to get vaccinated? Should they stay masked themselves?
Great. Well, Brian, first on the summer cash cards. So I think this has been a really important program. And what is important is that, as we've been saying, we need a mix of strategies to make sure that we are meeting folks where they are. We recognize that for some folks, taking time off of work and the transportation costs are truly meaningful. And I think this summer cash card, the $25 cash card, recognizes that you may have to take some time off of work or you do have to get transportation. And so we're compensating not just those who are getting vaccinated, but those who are driving others, because we know that is part of us all working together on it. We're really excited about how those 4 counties went and what we've seen, particularly from an equity perspective, making sure we're reaching underserved communities, our African American, our Latinx, Hispanic, and our Native American populations, that it's really worked well for those communities. And again, it's not surprising. Those are folks who do have to take the time off from work and have more challenges with transportation. So we think it's working. It is not meant to, one is not meant to replace. We're moving forward with both of them. In the coming weeks, hope to scale up both the summer cash card and to move forward with these $1 million drawings. And what I would say to folks who are living with others who are not vaccinated, I'd say those who are unvaccinated still put themselves and others around them at risk. When you are not vaccinated, it does mean that this virus could infect you at any time. Unfortunately, what we also have known is that the cases here in North Carolina are often variants of COVID, meaning that they are more contagious and sometimes more severe. So it's more important than ever to get a vaccine. These vaccines work against those variants. So we want to make sure that you are protected. We do encourage those who are unvaccinated to still wear a mask, particularly when they are around other people. So that would be my advice. If you are unvaccinated, please do wear a mask, particularly when you are indoors and around other people. Thank you.
And I just had a quick clarification. Just for people who are vaccinated, but in a household where that person isn't vaccinated, as the vaccinated person, do you need a mask if you are vaccinated?
Oh, if you are vaccinated, I think we've been clear that there is a wide range of things that you could do now that you could do before COVID. So when you have the vaccine, you are protected. But if you do not, you are not protected. And that is why I think we're putting out extra incentives and extra reasons why we want folks to get vaccinated right away. Thanks, Brian.
Okay, I think we'll go to those who are remote, and we'll take the first question from our remote reporters.
Our first question is from Jason DeBruin with WUNC.
Hi, thanks for the question. I'm sorry this is going to be just a bit off topic, but there is another big story that involves DHHS that's coming down the pike, having to do with Medicaid transformation going live in now less than a month, I suppose. I think clearly if it were not for COVID, there would be a lot more attention placed on this. And it does seem that there are a significant number of Medicaid beneficiaries who still have some questions or know very little about what's going to happen to their plans and how they're going to access Medicaid. What are the plans for the next 3-4 weeks, and then clearly in the months beyond the launch, to try to get good information out to Medicaid beneficiaries, to try to get them educated on what's going to happen to them and how they can access their healthcare providers?
Thanks. This is a significant change in the administration of Medicaid that the legislature put in place several years ago. Dr. Cohen and her team have been working constantly on this to make this as smooth as possible for both the Medicaid recipients and the healthcare providers. We're going to try to find positives in this. I'll commend our team. We're the first state in the country to introduce the Healthy Opportunities Program, where some Medicaid dollars can be used to prevent illnesses. That the example often used is a person who continues to go back and get treated for asthma. Why don't we remove the moldy carpet in that person's house so that we can get that person well and can reduce medical costs going forward? And so we're going to have a healthy opportunities effort going on in our state. Dr. Cohen has masterfully put that together, and we're looking forward to that being a national model. But I'm going to let Dr. Cohen comment on it and tell us where we are on it. Dr. Cohen?
Hi, Jason. Yes, our team has been very busy working on transforming our Medicaid program. It's the biggest change to our program in its history. It will start on July 1st, but what I would say is there's been years of preparatory work here. What is essentially happening, for those who don't follow as closely, is that the Medicaid program going forward is going to be administered by private insurance plans, which means for the first time our Medicaid beneficiaries need to choose a private insurance plan to be associated with. That process has happened. We had an open enrollment process and we did an auto enrollment process. So during the month of June is when they're getting in touch with their new plan. That is still happening right now. And so we want to make sure that if beneficiaries have questions, one, they can call their doctor that they've seen, or they can call our Medicaid helpline, and we can be sure to answer their questions. But we also have a lot of parameters and policies in place to make sure that as we do this transition, we're protecting beneficiaries. So if they don't like the plan they either chose or we enrolled them in, they can change for up to 90 days. So there's a lot of flexibility to both protect our doctors and our hospitals in this change, as well as our beneficiaries, and give folks flexibility. So hopefully this one can be a smooth transition. I will say with any major transition like this, of course, there are always things and questions we need to answer. So just know that we are ready to do that and want to make sure that everyone gets their questions answered, that patients are seen on July 1st, just like they would get seen on June 30th. So we're working really hard for that smooth transition. Thanks.
Next question.
Follow-up, Jason DeBruin, WUNC.
Thanks for the follow-up. And Governor, I know this is something that you've been very vocal on, but now that transformation is, at the doorstep, I know you're hopeful for a Medicaid expansion. Has there been any movement at all that you've seen from Senator Berger, Speaker Moore, other Republican leaders in either the House or Senate that, gets us anywhere closer to a Medicaid expansion effort?
I just talked with them both yesterday or the day before, and that issue is still on the table. It is not going to be in their proposed budgets that they put forward, but we talked about the fact that we're going to have an ultimate negotiation here before the final budget bill is put out, and there are other opportunities potentially in legislation to expand Medicaid. Most people across the state are for this. This is our opportunity to pull down an unprecedented amount of federal dollars, but it's going to save lives. Hundreds of thousands of working North Carolinians who work for employers who don't provide them medical insurance or who charge them so much that they can't afford it, they're going to be able to get health insurance. And in the middle of a pandemic, it is the right thing to do. It is the moral thing to do. It is smart economically to do it, and it'll create thousands of jobs. It'll help drive down cost of people's private insurance, even insurance of the state health plan. A lot of reasons to do this right now, and I hope that we can get it done. Next question.
Our next question is from Nikki Hauser with WITN.
Hi, Governor. I was wondering if you expect the vaccine numbers, to follow those of other states who have done this, like Ohio, who have implemented similar incentives, and is that a hopeful thing for you?
Was your question that what are the numbers from the other states? I know that in the first few weeks in Ohio that there was a 28% increase in vaccinations there. Were you asking about numbers in other states?
You were breaking up.
Yeah.
A
Do you expect to see a similar vaccine numbers here in our state?
Better. This whole idea of vaccine drawings and people being able to win prizes is something that's being talked about across the country. and has been talked about in North Carolina for a long time. So we're hoping for the best. I think we really don't know for sure what the effect's going to be. We are pretty sure it's going to be more. The question of how much more, we don't know. But we're going to spend the next few weeks talking to people about it and trying to really gin it up out there to get the interest. Next question.
Our next question is from Richard Craver with the Winston-Salem Journal.
Yes, Governor, Secretary Cohen, this is Richard Craver with the Winston-Salem Journal. I had a couple questions. One is, given that Monday will be a month since you issued your maskless order for most indoor and outdoor venues, I want to see how y'all feel like things are going and how people are either adhering or not adhering to it. And then, given we're about 2 weeks out from Memorial Day, if y'all are still concerned about any kind of COVID surge related to people being maskless over Memorial Day.
One thing that's clear, vaccines are working. And I think it's clear, too, that in most situations, people who are vaccinated would not need to wear a mask. And our numbers have continued to go down. And yes, we are, I think, close to a month from when we removed the mandatory mask order. I think our biggest concern is the virus really picking up among those who are unvaccinated. And that's where our concern, when you got over 2.5 million adults in North Carolina who have yet to be vaccinated, even with our numbers going down, yeah, you're concerned about things like Memorial Day weekend when a lot of people get together and a lot of them may be unvaccinated, and that you could potentially see a rise in cases. That's what we're trying to stem right now with getting more shots in arms. It makes it easier when you have a singular goal. Getting more people vaccinated means there's going to be less virus, there's going to be less sickness, going to be less death, and our economy is going to be even stronger, and it's going to make for a better state. Would you want to add to that, Dr. Cohen? Okay. Next question.
Our next question is from Josh Bergeron, the Salisbury Post.
Thanks for the question. You sort of talked about this, but maybe there's more to add either from the governor or the secretary. There's a fair amount of segmentation between individual county vaccination rates. And here in Rowan County, the rate's about 31% according to state data, 34% if you include the Salisbury VA. Meanwhile, in counties like Wake, it's over 50% and it's over 60% in some others. How is life going to look different both now and in the future, depending on the degree to which people in your county are being vaccinated?
We worry about counties and just areas of the state where a lot of people remain unvaccinated. There's a potential for more virus and more sickness and death, but I'll let Dr. Cohen address that specifically.
Hi, Josh. It is a concern when we see lower vaccination rates, and this is one of the reasons we are launching this shot at $1 million to give folks an extra incentive to get vaccinated. It's why we're using the summer cash cards to reimburse folks for transportation costs and time. But we have more work to do, and I'd largely say that the folks who are unvaccinated fall into three buckets. Generally, it's folks who definitely want to get vaccinated, say they are going to, they just need to make some time to do it. And from my perspective, that means we need to make sure it is easy, it's convenient, and again, these incentives, I think, help. I think there are a number of folks who have questions, and that is where the governor keeps encouraging folks to get good information about these vaccines. Always go talk to your doctor, but you can also get good information from us at the department, making sure that you know that these vaccines have been well researched, that they are very safe. More than 140 million Americans have safely gotten these vaccines, and I think we want to make sure folks get good answers to questions. And then I think there are folks who have said all along that they're not in favor of vaccines, and even for those, we're going to keep trying to make sure that we can answer questions and help them understand that their actions not only protect themselves but really impact their communities. And I know everyone cares about their families and their communities and want to do right by them, and so we're hoping with good information, a few more incentives, that everyone across North Carolina is going to get vaccinated. Thanks.
Next question.
Our final question is from Michael Hyland with CBS 17.
Hi, related to the lottery portion, are there any targets that you've set for where you want to see vaccinations go as a result of this announcement? Ultimately, how are you going to measure whether this is successful and actually worth the money?
Dr. Cohen.
Hi, Michael. So obviously we're going to look at what our baseline vaccination rates are right now, and we are going to do an evaluation to understand if there are going to be increases over the number of weeks. When we look at even the 4 counties we did that summer cash card, we certainly saw improvement in number of vaccines from that cash card. And so we will evaluate to see, we still had set an initial goal for us of having 66% or 2/3 of North Carolinians vaccinated, but we want to go beyond that. So I think we just want to make sure that folks know that there are incentives out there, that vaccinations are safe and effective, want to answer people's questions, make it convenient for them. And that's what we're focused on. And I think if we do that and we pull together as North Carolinians that we're talking about those of us who have gotten vaccinated, share our stories with our friends and family, I know we're going to continue to make progress here. But if you look at North Carolina compared to some, other states, we are starting to lag behind. I'm proud that we are doing well compared to a lot of other states in the South, but there are many states who are now seeing 70% of their adults vaccinated. We can get there too. I hope today's announcement will help us launch forward even faster. Thanks.
Thanks, everybody, for being with us today. Make sure that you have your shot at 1 million. Thanks a lot.